Okay, so quick update for any of you who have followed this ridiculous journey. First of all, Monday, so 3 days, will be the 3-year anniversary of the coma. So my Facebook memories popped up yesterday with a video I made 2 years ago. And I was super excited because it was after the second round of DKA. When I opted for insulin, I was only using a 24-hour insulin, and it was 25 units once a day. And we were down then, like we've been decreasing it, we were down to 13 units with an eye to go to 10. So I was super excited. Now, about 3 weeks later, I got strep and double ear infection and this voice and the relapsing polychondritis and all that. But I'd forgotten what my voice is actually supposed to sound like. But here is an update. I've had 4 doctor's appointments in 2 days. Yesterday was nephrology. And for those of you who followed the whole coma saga, you know that my kidneys did not work. I had acute kidney injury. I was on dialysis. It was a whole thing. So yesterday was a 2-year follow-up with my nephrologist. And he was incredibly pleased. He said that Mary Kate and Ashley, that's what my sister named my kidneys, Mary Kate and Ashley are doing phenomenally well. He could not ask for better results. So he said, unless you have issues, don't come back for 2 years. And if you're still not having issues at that point, you can even put that off for another year. So yesterday was fantastic news from my nephrologist. So this morning before 8 o'clock, I went to my vocal cord specialist, and he ran the scope, and he said that there is no swelling, there's no redness, like all the tissue looks beautiful. It's vibrating like it's supposed to. But again, you know, they're pretty sure that there is some nerve damage and they're not closing. They're like, when you look at them, they're a little off and they don't close perfectly well. And so I'm continuing to do vocal cord exercises, voice therapy exercises and things like that to just try to rebuild some of that. They don't know that I'll ever get my voice back to normal. Maybe this is it. Maybe it can show some improvement. You know, he gave me some more things that I can do that I'm gonna try. So then was endocrinology. Now keep in mind, 3 years ago, I had a primary care and that was it. Now I have 4 specialists. So endocrinology, my A1C is 5.5. Now, I have been on, now I have, because of the relapsing polychondritis and the meds for that, not only do I have the 24-hour insulin, I also have corrective insulin. So we had already moved my long-acting insulin from 25 units to 20 units. And she said, well, I want you to drop it to 16. And I said, I'm not comfortable with that. So we're going to 18. And then if I continue having lows, then she wants me to drop down to 16. So all that's going in the right direction. And of course, kidney function is good, and that goes along with endocrinology. So all of that looking good. So then I went to rheumatology. I have been on prednisone for over 1.5 years. And if you know anything about prednisone, first of all, you know it's horrible on the body. Shuts down the adrenal glands, like it can mess with a lot of things. It makes you pack on the weight. First of all, it increases your hunger, but even though I have not really increased my food intake, it shut down my adrenal glands. It causes muscle wasting. I started at 40 milligrams a day for several months. And so it also shoots your blood sugar up. So I was having to do a lot of corrective insulin. Well, then we were able to taper me to 30, then to 25, then to 20, then to 15, 10, 5, 2.5 milligrams a day. Now, it has taken, again, a year and a half to do this. Well, today she dropped me to 1 milligram a day for 30 days, and then I'm off. Because you do have to taper it very slowly, especially when you've been on it this long, or it can cause your adrenal glands to just freak out. And there's some big long name for it, and I don't remember what it was. But she said within, like, in a month, after 30 days of 1 milligram a day, I'm to stop. And then I'll go back and see her in a month, and we'll see how things are going. So even though my voice is awful, even though I'm still diabetic, I still have the relapsing polychondritis, I'm still on 2 kinds of insulin and all that. Every single doctor, all 4 of them, had nothing but great news to give me. So I am very, very thankful and blessed, and I'm so grateful to God that despite how I sound, my health is improving. Now, my rheumatologist did say that it will take several months once I'm off of the prednisone, before all this weight that came on with it, before it starts disappearing. But my body will be able to start recovering, hopefully. I will still be on an immunosuppressant, but only one. At one point, I was on prednisone, methotrexate, which means folic acid, and the Cellcept. Then she took me off the methotrexate and added Humira. Now I'm off the Humira, and I'm about to be off the prednisone, which will leave me with just Cellcept, which I'd still like to be off at that, but it's autoimmune. I don't know that that'll ever happen. But anyway, there's an update. Again, Monday will be the 3-year anniversary of me not waking up. So, it's a little, I haven't been sleeping well for the past week and a half, as I think that after Monday, once that anniversary is passed, I'll be able to finally sleep again. And I've got nothing but good news from 4 doctors in 2 days. So there you go. I'm very hopeful that things will continue to improve, and I'm seeing some improvement in my voice. So I'm hoping, but at least it all still looks good in there, and it's not, Anyway, there you go. There is your update about all the things.